Hello and welcome to My Body, My Rules from Mulock and Yonge Chiropractic Health and Wellness Center. I'd like to introduce you Dr. Gudrun. She's our naturopathic doctor.
And this is Dr. D, Dr. Darren, our famous chiropractor.
Thank you very much, Gudrun. Today we are going to talk about the road to recovery. Now, we've been discussing this for a while as we've gone through and discussed recovery programs with many different patients. I think this is something that we should clarify for people. So, when people come into the clinic, they're most commonly triggered by symptoms to do something to change their health. When they come into our clinic, they will receive a diagnosis. So the first step is find out what's wrong. We get to the source of the problem, and then we work on a treatment plan to correct the source of the problem. Now, when people start their problems, there's definitely issues of suffering, of symptoms, and whatnot. And as they go through their treatment or adjustments, they can respond to the treatment or adjustments in three different ways. One, we've noticed for some people, they start to respond very quickly and they see changes, which is great. And then they slowly taper off and they get then to the point where they're feeling fine. Some patients, and this is difficult for some people start through their treatment program or get their adjustments and there's no change at the beginning. It's very difficult for them and they can't see what the purpose is yet because they're judging how they're healing by how they feel. And once they stick through this for a few days or weeks, then they start to get better. And then the rewards are met with their health. A small group of people start their treatment or adjustments and then they actually start to feel a bit worse. Then, if they can ride that out, then they start to see the results of getting better. Now, why people get worse sometimes? Well, it depends on what you're judging and how you're judging your health through your symptoms. For myself, for the registered massage therapist, and sometimes for Dr. Gudrun as well, some people feel more body aches and pains. Muscles are changing lengths, ligaments are adapting, your spine is moving and adapting to new ranges of motion, scar tissue is breaking down, organ function is changing, fluid levels are changing, body water composition is changing. We can go through many changes of symptoms that at the beginning may feel not as good as before. But once that starts to equilibrate or get back to normalcy, then they start to feel better. And that is, for us, I believe, especially for me, and I know for Gudrun as well, these are the most rewarding patients because they usually come in with a whole multitude of symptoms. They are truly complicated cases, and it's going to take a while to sort that body function out. It's analogous to when you clean out your room. We're into spring right now, and if you happen to do your home cleaning and you clean out a whole room and then you stop and say, am I better off right now or not? And sometimes you look at the mess that's created and say, well, geez, I'm kind of in a worse state than where I was before. But once everything gets put back to order, then you feel better about the room, and the room is a lot better as well.
Yeah, and I mean, one of our little pet peeves that we have is when somebody comes in and we help them get to this point where they're out of pain, they're feeling better. We know that we can actually bring them to a place where this pain or whatever the issue is not going to go back into an emergency state. But because they feel a little bit better, then they don't come back in to see us to follow up with what we can do further for them. Now, you said you have a small amount of patients that get worse. I would say honestly, when I'm looking at the whole body healing and like healing for a lifetime, probably every one of my patients will experience a dip in some form. So they may be experiencing a dip in maybe their allergies got worse, but like if we're looking at gut healing, certain foods they're able to have without reacting to, but then they become more sensitive to other foods. This is all part of the healing process. Or for me, another thing that patients will complain about is as we are moving them from living on adrenaline or cortisol into getting their energy from food and sleep, they actually want to sleep more. That's a healthy thing, but they'll complain because they feel like they have less energy. What's actually happening is they're able to tune into their body and know that they actually need sleep, and that sleep is, you need more than 4 hours of sleep to heal.
Absolutely, and theoretically, you know, it would be great if we could receive a treatment or adjustment and we get better. And we create a linear progression where every day you get better, every day is better and better and better. But the reality is, due to our lifestyle, whether there's physical stressors, emotional stressors, environmental stressors, some of those days are going to cause our body to react differently. And yes, we will have days where we feel great, but then we have days where we don't feel so good. Then we feel better again. And the key is to monitor that progression so that the days where you feel better become more and more greater, the duration becomes longer, and there really is less times of when you don't feel so good, to the point where sometimes we ask the patient on a visit, so how are things really going? Like, have you remembered that at this point in time in your healing that certain situations or work conditions caused you a lot of grief? And the patient kind of looks at us and says, yeah, you know what, that's not happening anymore, right? Because their bad days aren't as bad as at the beginning, and their good days are longer and better as they keep progressing. And this whole relapsing business is based on symptomatic care, which is why our healthcare system is in the state it's in. This process of treat a symptom, try and get it corrected, treat a symptom, try and get it corrected, is way more cost prohibitive and more expensive than someone that actually tackles the problem, solves the biomechanical issue or internal body situation, and stays in a state of health.
So in conclusion, if you are a patient of ours and you haven't been in for a while, we would love to see you again. And if you're seeing another healthcare practitioner, or you want to start to actually change things for a lifetime, we recommend really finding a good healthcare plan and sticking with that plan.
Absolutely. Stick it out, because your health is the most important.